behind, please.
Oh, sorry. Did I skip? Okay. All right. Maria Schultz behind, please.
Okay, thank you, PPMD and FDA. My name is Debra Miller, mother of Hawkins and founder of Cure Duchenne. I have a double interest in seeing exons giving drugs approved for Duchenne, obviously as a mom, and also since Cure Duchenne provides substantial funding to both companies that are developing these drugs. My son, Hawkins, will be 17 years old in 5 weeks. He is still walking. In fact, he is driving a regular car and is fairly independent. He has 3 to 4% normal dystrophin, reverse fibers. If this very small increase in dystrophin over 0 can enable him to do these things, then we need to get these drugs to kids, regardless of whether we completely understand how, why, or how much dystrophin is increased. Even though my son is doing a little bit better than some with Duchenne, he's getting steadily weaker. When I see a new sign like struggling to get up off the chair, it is a stab in my heart. I worry about my son losing his ability to walk. Then I will worry about his ability to feed himself or use a computer. Then I will worry about his death. What risk will I accept in considering an experimental drug? Side effects that are able to be monitored and can be reversed by cessation of the treatment. What risk am I able to accept? Doing nothing while there are drugs that could slow down his disease progression so that he may be here to take advantage of science that will surely develop even better drugs in the future. It's taken for granted that dystrophin plays an important role in helping stabilize the muscle membrane, and furthermore, the loss of this protein is seen as the causative factor of Duchenne. We feel, therefore, that dystrophin is uniquely positioned to be an obvious and ideal biomarker for this disease
30 seconds.
and should be used for more rapid approval. We ask the FDA to factor in real-life relevant endpoints that reflect the potential improvements that affect the quality of life for patients. We ask you to pay attention to the parents' voices. And just within the last few days, this community lost 3 boys to Duchenne. Their ages were 10, 14, and 17. Although there are cases of Duchenne patients living longer, it is not safe to say that the prognosis has changed that dramatically for our sons. If the FDA approves a drug that has manageable side effects and does not produce the clinical benefits we all hope for, that will be a disappointment. However, if the FDA does not approve a drug that does prove to save the lives of our children, many boys will have lost the ability to walk and to breathe. That is a greater risk, and that is a greater error.
Debra behind.